Hello everyone, welcome to my channel all about nursing. So this is a nursing channel. Today we will learn the topic blackout. It is a very important topic as this question is appears in short answer type question last year. So we will proceed with this blackout. The other name of blackout are fainting, syncope, TLOC, that is transient loss of consciousness. So these three words also we can use to refer the blackout. So blackout is a symptom, not a disease. Next one is definition. First we will learn the definition of blackout. So blackouts are periods of unconsciousness or loss of memory. So when the patient becomes unconscious or there is a memory loss, sudden memory loss due to unconsciousness, that condition is known as blackout. During blackout, patient is not aware of their surroundings or actions. Patient becomes unaware suddenly. He becomes unaware of their surroundings, about their actions, and he has trouble remembering them afterwards. That is, the patient is not able to recall what happened to him, what he did. So after definition, we will proceed with the causes of blackout. So it is divided into three parts, that is traumatic cause, substance related causes, and any disease or disorder. So first is traumatic. Traumatic is maybe due to some trauma. If patient is undergone through electroshock therapy, so after electroshock therapy or after ECT, the patient may become blackouts, may become faint. Patient is had undergone through any brain surgery, that would be a cause of blackout. Patient is having any head injury. So any injury or any surgery, if patient is having any type of therapy through which patient has undergone, these would be causes of blackout. So these are under the traumatic cause. Next is substance related, like patient is having alcohol abuse or alcohol intoxication, then patient may become blackout. Any patient who is having medication such as like medication he is having for seizures or for seizure medication plus any cancer treatment if patient is having, so that patient, cancer related medication and seizure medications have side effect of fainting, blackout. In that case also patient become blackout. Next is poison. Poison are such as any pesticides or cleaning agents if patient has ingested or that may result in fainting. So these are substance related causes. Alcohol abuse, medications, some of the side effect of some medications may cause blackout. Poisons like pesticides or any chemical if patient is ingested. Next is disease related. Third one is disease related or disorder. Patient is having anemia, anemic patient may have fainting. Patient is dehydrated, second one is dehydration. Then brain infection cause blackout. Postural hypotension means there is a changing of position from lying to standing. If patient changes his position, suddenly change his position from supine to standing, his BP becomes low. So that is called postural hypotension. That is also a major cause of blackout. Next one is vasovagal syndrome. What happens in vasovagal syndrome? It is the syndrome in which patient reacts to certain stimuli. That may be like a sight of blood or maybe due to some external emotional distress. So it is a vasovagal syndrome in which patient overreact to some stimuli, and what happens then, his BP and his heart rate drops suddenly. So these are the three main causes of blackout. So after definition and causes, next one is symptoms of blackout. First one is palpitation. Palpitation is irregular or rapid heartbeat. Suddenly patient's heartbeat become irregular or rapid. Next, muscle spasm will be there. Nausea, vomiting with or without. Only nausea will be there or with vomiting. Nausea with vomiting or without vomiting. Next one is dizziness. Changes in hearing, changes in mood, headache, changes in vision. He may have blurred vision or maybe sometimes loss of vision or temporary loss of vision will be there. Next one is changes in LOC, levels of consciousness. Chest pain or pressure, inability to speak, unable to move any body part or maybe some part of the body become paralyzed. Breath shortness, breathness problem will be there, seizure will be there. So these symptoms may occur when patient is having blackout. Next one is complications of blackout. So after blackout, the brain of the patient may become damaged. Injury during blackout episode will be there. Neurological problems like patient may having confusion, letharginess, memory loss. Memory loss will be there. Confusion will be there. After blackout, next is permanent nerve damage. Permanent nerve damage may happen that may result in paralysis of some part of the body. So blackout can be diagnosed as physical examination. Physical examination involved to check the skin of the patient for any paleness, skin paleness or dehydration. Then ECG, continuously ECG can be done to assess the heart rate level. Then EEG for brain functioning. And next, tilt table testing. It is a test which is used to evaluate the unexplained cause of the fainting. What happened in this? The patient is placed on lie on the table with his body position from horizontal to vertical. So to assess whether there is a cause of fainting is due to postural hypotension. So this test is used, that is tilt table testing. So these are the 4 main tests which we used to diagnose the cause of blackout. So next one is nursing care for blackout. If you see any patient who is having blackout, so what would be your responsibility? First one is, first of all, assess the conscious level of the patient, whether he is conscious or unconscious. So the other all remaining care will be depend upon this. How was the condition of the patient, whether he is conscious or unconscious. So next, after assessment of patient's conscious level, next we will call for assistance. If we call for someone for help, then positioning. The positioning after shifting the patient to the bed, what would be the position of the patient with blackout? If patient is having blackout, he should be placed on the spine position with legs slightly elevated. So the legs part should be slightly elevated. Next one is, after proper positioning, after giving comfortable position to the patient, next assess the ABC, airway, breathing, circulation. Assess for ensure for patent airway of the patient. Breathing pattern should be assessed. Circulation level, ABC must be assessed after the positioning. Then after assessment of ABC, administer oxygen to the patient if needed or as ordered. Next, vitals monitoring. Monitor the vitals of the patient. Monitor for BP, heart rate, pulse rate,